Good afternoon, ma'am. I'm Adrian Vincent M.U., student from ADS2, second year, ma'am, taking the course of Bachelor of Science in Nursing. I am here, ma'am, because I will be the student nurse for today to do the essential assessment and necessary, which is the uterine involution. It is the purpose is to return your reproductive system or your reproductive parts to the previous pregnant state, and it will also be beneficial because it will produce maternal comfort and enhance your reproductive tract recovery, and the result is will lessen your possibility of having infection of genital tract, or in medical term it is peripheral sepsis. So ma'am, let me first perform an hygiene. And don't worry, ma'am, because as you can see, doors are closed, curtains are closed, and I will not overexpose your body. I will only expose the area of the assessment. So let's only assume that the patient is already been raped. I will now wear my gloves. Then perform again hand hygiene. So, for the assessment, ma'am, let me massage your uterus to express blood clots and expel the packed blood, so I can help to improve your uterine firmness. And I will do this assessment by I will place my non-dominant hand above your symphysis pubis. Then, after placing my non-dominant hand above your symphysis pubis, I will now try to steady your uterus, and I will use my dominant hand in a gentle way. I will massage the uterus in the circular motion using the dominant hand. And my non-dominant hand will only be placed steady in the symphysis pubis to support the uterus. I will do this in circular motion. So let's assume that I've already done in massaging the patient. The assessment is already done. Now have I will only state some explanation for the patient. That is necessary explanation for this assessment. So after massaging the uterus, don't forget to assess the uterine fundus, and this assessment can be in four ways. So first, first way or first method, every 15 minutes during 1 hour after delivery of placenta, and mm, after the arrival of the client or upon the arrival of the client. It is then second, every hour for the next 24 hours. Then third method, every 4 hours for the next 24 hours and every 8 hours thereafter. So don't forget to teach the mother to massage the soft uterus in a appropriate but only firm and gentle way. Then the pressure must be only gentle. And mom, they assure that after pains, uterine is intended to cramps secondary to contraction of uterus. Though it is uncomfortable, but it is just normal. It will decrease the frequency and intensity as the uterus involves to its position. So, for this assessment, after massaging and assessment of the uter uterine involution, don't forget to give oxytocin medication as ordered or, or ordered by the doctor, and always encourage breastfeeding for the mother, the baby, and always note that hormone oxytocin releases during breastfeeding, and its rationale, it will contract uterine mus uterine musculature, and it will enhance the involution of the uterine. So they assure to the patient that the uterine discomfort that she will felt is just normal and it will exist during breastfeed. Then, next, encourage early ambulation to promote uterine involution or to have better uterine involution. So, always encourage to have early ambulation to the patient. And next, evaluate involution by the amount and character of the lochia or the bloody show to the vagina discharge. And instruct the client always on perineal hygiene, appropriate perineal hygiene to prevent peripheral sepsis or infection to the uterus and other reproductive parts that are related to the uterine involution or can affect the uterine involution. So, always instruct the patient to have perineal care, perineal cleaning, or hygiene to prevent peripheral sepsis. And after that, also encourage the patient to have regular emptying of the bladder, even if there is no desire to void, because a dissented bladder does not only predispose the mother to urinary tract infection, but also interferes with normal contraction of the uterus, which may result to postpartum hemorrhage and also will affect the possibility of complications in the uterus, and it will not have a great result of uterine involution. So, after explaining the procedure to the patient, after doing the assessment of uterine involution, don't forget to document findings in the nurse's notes. And now, I'm ready to dispose the grabs in a aseptic way. Then, for formaldehyde hygiene, and that's all.